We're seeing pink all month long. October is Breast Cancer Awareness Month, and now more than ever, it is a time that we can empower ourselves and others to learn about and seek proactive breast care. St. Alphonsus Regional Medical Center breast cancer surgeon Dr. Elizabeth Pryor tells us what it means to be at higher risk for breast cancer and how a new program is helping patients gain access to proactive care. What does it mean to be at high risk for breast cancer?
What it means to be at high risk for breast cancer is that you have an increased risk of developing breast cancer over your lifetime, which can be due to either a family history of breast cancer, like your mom or your sister or grandmother had breast cancer, a history of multiple breast biopsies, so you've gone in for a mammogram and they've seen a problem that had to be biopsied that maybe showed some atypical changes, and then also breast density can factor into that. That means how thick your tissue looks on a mammogram. That's a risk factor for breast cancer as well. The average woman in America has about a 10 to 12% lifetime risk of breast cancer, and then some of those factors we just discussed can take that risk to over 20%. And once you reach a greater than 20% lifetime risk of breast cancer, then you would be considered elevated risk and might want to consider some extra screening or management options.
Explain why you decided, though, to make the high-risk breast cancer program here at St. Alphonsus.
Breast cancer screening is, as we kind of just alluded to, not one size fits all. By having a high-risk clinic, we can kind of select for women that may be in an elevated risk of breast cancer, and we can help manage screening options and do some other screening and testing.
Okay, and paint the picture of who would benefit from taking advantage of this program.
Sort of best example would be two people. One would be somebody who has diagnosed breast cancer genes. There's a couple of different ways people can manage that gene mutation. Some people do extra screening, for example, a mammogram alternating with a breast MRI every year. And some people opt to do like a preventative double mastectomy. By identifying somebody with a breast cancer gene like that and plugging them into our high-risk clinic, we can talk them through those different management options and see what's the best fit for them where they're at in their life. The other person would be somebody who doesn't have a breast cancer gene but might have a family history. We can do genetic testing. We put that together with kind of what's your breast density on your mammogram. If you have extremely dense breast tissue and that family history, you would benefit from doing supplemental screening with like an MRI.
It sounds like incredible support. Help us understand, too, the additional support that you provide for patients in this program.
Sure. So there's a couple things we provide by coming into the clinic. Genetic testing is something that we offer to everybody. We can offer different types of supplemental screening. Breast MRI is the most common sort of supplemental screening to a mammogram, but there are other options like automated whole breast ultrasound. And we also have genetic counselors that work with us in our program. And then obviously if people are interested in more lifestyle things, we can always plug them in with a nutritionist or things like that.
And how often are they seen in this program?
So we usually see folks about once a year, but in between that, you're getting that other imaging. So we'll help coordinate. Do you need a mammogram and MRI? We make sure that imaging is scheduled and up to date and authorized for you.
And this program is not only available here in Boise, but other areas of the Treasure Valley as well, right?
Correct. We have high-risk breast clinics here in Boise at our main St. Alphonsus campus. We also offer a high-risk clinic in Nampa with one of our surgeons there, Dr. Homer. And then we also have a high-risk clinic in Ontario that's led by Dr. Bruce.
Where can people go to learn more?
So you can go to our website at stalphonsus.org/HRB. You can also use the resources on the screen, phone number, and you can also have your primary care physician refer you to our clinic.
Wonderful. Thank you so much.
Yeah, thank you.